Hello everyone, this is Raymond Lee of Raymond's Dental Solutions. Today, let's take a look at an actual case where a staff member in a dentist is a very recognized person by the doctor because she or he handles internal affairs neatly and becomes a very bad staff member for patients. The flight from JFK to Incheon took 15 hours, and the taxi ride from his home to the dentist office took an additional hour. When Mr. Park secondarily went into the dentist office, the receptionist glanced at him and said nothing, even though she had known where Mr. Park came from. After waiting a little while, he approached the reception desk and said, "You did not say hello," expecting a general response like, "Sorry, I was too busy to say hello," or some such. But the receptionist only said, "Please wait over there." No greeting or apology was going to be offered. Mr. Park was annoyed and thought, how could someone like that be a receptionist? Later, he found out that this person was someone with more than 20 years of experience and was well trusted by the doctor. Also, she was not just a receptionist, but a floor manager. Apparently, to the doctor, she must have been a great staff member. 4 months later, Mr. Park visited the office again for the final procedure of the placing a permanent crown. After the whole process was completed successfully, the doctor suggested that it would be better for Mr. Park to stop by and get the last checkup before he went back to the United States. Mr. Park decided to take up this suggestion, so he went back to the front desk and asked the staff member there if he should make an appointment for the checkup the doctor had recommended. She said that there was no need to make an appointment and that he could visit at any time. He assumed he may not need an official appointment because the final visit would be a quick 1 or 2 minute visit. The day before his return trip back to the United States, Mr. Park made time in his busy schedule to visit the clinic for a final checkup. As before, it took an hour for him to travel to that office. When he arrived, the doctor was treating a patient, and 2 other patients were waiting in the lobby ahead of him. Mr. Park greeted the receptionist, sat down in the waiting room, and began to wait. After a while, he went back to the front desk and asked how long it would take to get his final checkup with the doctor. Without consulting the doctor, the receptionist said that he would have to wait a long time and that it might actually be difficult to see the doctor that day. She did say it was true that he could come in at any time without making an appointment in view of the fact that he would be returning to the United States the following day. However, the bottom line was that she did not arrange a short consultation with the doctor, nor did she discuss it with the doctor, nor did she politely apologize for the inconvenience. She simply sent the patient away. These 2 encounters clearly indicate that the staff member in question did not have any common sense concerning proper ways of handling patients. She had no awareness of how her speech and behavior might be perceived by patients and what kind of impact they would have on them. Such inconsiderate treatment would cause a patient to get extremely upset, and he or she would not wish to recommend this office to anybody else, no matter how skillful the doctor may have been. Regardless of the length of the experience this staff member may have had, whether it be 20 or 30 years, and regardless of how much recognition she might have received from the doctor, such a receptionist simply ends up hurting the practice and making bad impressions on patients. Could such a person ultimately be a good staff for the doctor? Of course not. In the end, the doctor's business is a business that can only succeed through the satisfaction of their patients, as is the case with any other service industry. No matter how well a staff member performs his or her duties internally, when they make patients upset and continue to provide dissatisfactory service, they would end up hurting the business. Therefore, a doctor should never be satisfied just because they performed good work for him and are internally competent. What is crucial is how kind, competent, and satisfactory the staff is toward patients. This is because the success of the business is proportional to the level of satisfaction of its patients. It can be said then that when evaluating staff members, a doctor should not only rate a staff member's competence against an internal set of standards, but also should consider him or her from the patient's perspective. Ideally, it would be nice to have a staff member who provides satisfactory service both internally to the doctor and externally to the patients. However, in reality, it is not easy to find such a person. In that case, the next best choice would be to select someone who would provide satisfactory service to the patients rather than someone who might be competent within the office but is lacking in their care for the patients. The dentist office Mr. Park visited ended up becoming one that he would not go back to because of the staff he interacted with, although the doctor seemed fine. It is unfortunate that the doctor did not seem to be aware of this. Thank you so much for your watching.